Thank you, Dr. Singhi. As usual, you've shown us some excellent cases, and you have a whole lot of them in your laptop, I know.
My pleasure, sir. If you have liked, I'll be very happy.
Now, I would ask if anyone has any questions to ask Dr. Singhi. I have an adult echocardiographer, so I leave it to your pediatric colleagues to ask any questions. The first case that you showed, could you make the diagnosis while doing the echo the first time?
Yeah, when the dilated RSBC was the clue, and the dilatation, disproportionate dilatation. I don't
Right.
expect that much of dilatation in a single vein draining. So coronary sinus dilated as well as RSBC dilated. I never saw. This was the first time I was seeing myself, and I found literature it is extremely rare dual drainage. The importance is the surgeon should be aware. If we get one diagnosis TAPVC and the surgeon will do vertical vein, they will retain without knowing, and that will be a very difficult job post procedure. So they ligated both, and the importance of getting this diagnosis. So we could diagnose this on the echo on the day one itself. The CT was just done to confirm and convince the surgeons.
Right. Excellent cases. Dr. Dedatta?
I was just wondering, Dr. Singhi, excellent presentations as usual. And just wanted to ask that the child was the third child, the adolescent boy, he was wheelchair bound. So was it only because of the cardiac condition, or was it associated like isolated valvular PS, and was it
Very
associated
nice
with
thing.
any other?
You asked a question and the answer was there in the last slide.
Yes, I know. No,
He
this
came
was
with as if nothing happened. He was like a modern, very happily enjoying adolescent. So it was severe hypoxia, prolonged severe hypoxia, RV dysfunction, leading to completely wheelchair bound. He was saturating some 65, 70s. So it is bad. Prolonged hypoxia is
yes.
bad thing, and it
So
made him crippled.
it's very it's very interesting to see how the hypoxia affects the newborns and the older people in a different way. In newborns, you would have more of a neurological sequelae and all those neurodevelopmental issues that may crop
But
up.
that will be there in
But
the congenital heart disease. Babies who are hypoxic, they're tuned to hypoxia in the fetal life. So if we do correct in time, that does not cause much trouble, rather than a normal newborn who are not accustomed to hypoxia and developed
right,
hypoxia. That
yes,
hypoxia is dangerous.
right, right.
But tuned hypoxia usually does not cause that much harm. There are multiple MRI studies. Some
Hmm.
reduction may be there, like TGA. They are tuned,
Yes.
tuned.
The
But
in,
but a child having normal heart developing hypoxia is a tricky game, and
very, very, very,
I
very.
think both are
It's
different
very
issues.
interesting to see the varied and the myriad presentations and the consequences as well.
And the
Thank
second
you.
case, I'm thankful to our echocardiography conference, and the second case got accepted for publication. There was a series of basically 3 cases where I found ARVD in presence of lesions causing right side dilatation. One was ASD and two ASD and one Epstein anomaly. So I think it is not that uncommon, and if we keep looking, possibly we can get some surprise.
The second case was excellent, Anil. The second case in association with the ASD, which you showed, was really.
Dada, see, I got total 3 cases, and I was surprised. I was talking to Dr. Ghosh also, that it is really surprising to see, and all patients have a different outcome because they were not sent for surgery, rather sent for medical therapy and management. So the huge change in the management protocol, all came for surgery or device closure, and all had a different outcome. So the point is, if we are more alert, possibly we can detect something.
Right. Thank you, Dr. Singhi, for
My
those
pleasure.
beautiful cases. So we'll have to move on to our next session. The next speaker is Dr. Devdatta Mukherjee. She will be showing us 3 cases on DSD, TOF, and DGA. And there will be a discussion followed by those, along with these cases. The panelists for the discussion are Dr. Shushan Mukhopadhyay, Dr. Kaushik Mukherjee, Dr. Amitava Chattopadhyay. Dr. Diddata Mukhopadhyay is the Associate Professor, Pediatrics, West Bengal University of Health Sciences. She is a reviewer of Journal of American Heart Association, and she is also the Vice President of Pediatric Intensive Care Society, Kolkata. Dr. Mukherjee, please.